Welcome to Medical Destiny YouTube channel. Before watching this video, please take a moment to subscribe my channel. In this video, we will go through 20 NCLEX practical nurse multiple choice questions and answers. If you like this video, please share it with your friends. Let's begin.
81. The nurse is assisting with caring for a client who will receive a unit of blood. Just before the infusion, it is most important for the nurse to check which item? 1. Vital signs. 2. Skin color. 3. Oxygen saturation. 4. Latest hematocrit level. Answer. 1. Rationale. A change in the vital signs may indicate that a transfusion reaction is occurring. The nurse assesses the client's vital signs before the procedure to obtain a baseline every 15 minutes for the first half hour after beginning the transfusion and every half hour thereafter. Skin color, oxygen saturation, and most recent hematocrit may be checked but are not the most important. 82. A client who is receiving a blood transfusion rings the call bell for the nurse. When entering the room, the nurse notes that the client is flushed, dyspneic, and complaining of generalized itching. How should a nurse correctly interpret these findings? 1. Bacteremia. 2. Fluid overload. 3. Hypovolemic shock. 4. Transfusion reaction. Answer. 4. Rationale. The signs and symptoms exhibited by the client are consistent with a transfusion reaction. With bacteremia, the client would have a fever, which is not part of the clinical picture presented. With fluid, circulatory, overload, the client would have crackles in addition to dyspnea. There is no correlation between the signs mentioned in the question and hypovolemic shock. The signs identified in the question are indicative of an allergic reaction, which is one type of blood transfusion reaction. 83. A client who is receiving a blood transfusion has experienced a transfusion reaction. The nurse sends the blood bag that was used for the client to which area? 1. The pharmacy. 2. The laboratory. 3. The blood bank. 4. The risk management department. Answer. 3. Rationale. The nurse prepares to return the blood transfusion bag containing any remaining blood to the blood bank. This allows the blood bank to complete any follow-up testing procedures that are needed after a transfusion reaction has been documented. The remaining options are incorrect. 84. The nurse takes a client's temperature before giving a blood transfusion. The temperature is 100 degrees Fahrenheit orally. The nurse reports the finding to the registered nurse, RN, and anticipates that which action will take place? 1. The transfusion will begin as prescribed. 2. The blood will be held, and the health care provider will be notified. 3. The transfusion will begin after the administration of an antihistamine. 4. The transfusion will begin after the administration of 650 mg of acetaminophen, Tylenol. Answer. 2. Rationale. If the client has a temperature of 100 degrees Fahrenheit or more, the unit of blood should be held until a healthcare provider is notified and has the opportunity to give further prescriptions. The other options are incorrect actions. 85. Which of these clients are most likely to develop fluid, circulatory, overload? Select all that apply. 1. A premature infant. 2. A 101-year-old man. 3. A client on renal dialysis. 4. A client with heart failure. 5. A client with diabetes mellitus. 6. A 29-year-old client with pneumonia. Answer. 1, 2, 3, 4. Rationale. Clients with cardiac, respiratory, renal, or liver diseases and older and very young clients cannot tolerate an excessive fluid volume. The risk of fluid, circulatory, overload exists with these clients. 86. A client has a prescription to receive 1,000 milliliters of 5% dextrose and 0.45% sodium chloride. After gathering the appropriate equipment, the nurse takes which action first before spiking the 4 bag with the tubing? 1. Uncaps the distal end of the tubing. 2. Uncaps the spike portion of the tubing. 3. Opens the roller clamp on the foretubing. 4. Closes the roller clamp on the foretubing. Answer. 4. Rationale: the nurse should first clamp the tubing to prevent the solution from running freely through the tubing after it is attached to the forebag. The nurse should next uncap the proximal, spike, portion of the tubing and attach it to the forebag. The forebag is elevated and the roller clamp is then opened slowly, and the fluid is allowed to flow through the tubing in a controlled fashion to prevent air from remaining in parts of the tubing. 87. The nurse is doing the routine assessment of a client's peripheral intravenous, 4, site. The nurse notes that the site is cool, pale, and swollen and that the 4 has stopped running. The nurse determines that which has probably occurred. 1. Phlebitis. 2. Infection. 3. Infiltration. 4. Thrombosis. Answer. 3. Rationale: an infiltrated 4 is one that has dislodged from the vein and is lying in subcutaneous tissue. The pallor, coolness, and swelling are the result of 4 fluid being deposited into the subcutaneous tissue. When the pressure in the tissues exceeds the pressure in the tubing, the flow of the 4 solution will stop. The other 3 options identify complications that are likely to be accompanied by warmth at the site rather than coolness. 88. The nurse is assigned to care for a client with a peripheral intravenous, 4, infusion. The nurse is providing hygiene care to the client and should avoid which while changing the client's hospital gown. 1. Using a hospital gown with snaps at the sleeves. 2. Disconnecting the 4 tubing from the catheter in the vein. 3. Checking the 4 flow rate immediately after changing the hospital gown. 4. Putting the bag and tubing through the sleeve, followed by the client's arm. Answer. 2. Rationale: the tubing should not be removed from the 4 catheter. With each break in the system, there is an increased chance of introducing bacteria into the system, which can lead to infection. Using gowns with snaps and inserting the 4 bag and tubing through the sleeve of the gown first are appropriate. The flow rate should be checked immediately after changing the hospital gown, because the position of the roller clamp may have been affected during the change. 89. The nurse is making a worksheet and listing the tasks that need to be performed for assigned adult clients during the shift. The nurse writes on the plan to check the intravenous, 4, of an assigned client who is receiving fluid replacement therapy. How frequently? 1. Every hour. 2. Every 2 hours. 3. Every 3 hours. 4. Every 4 hours. Answer. 1. Rationale: safe nursing practice includes monitoring and 4 infusion at least once per hour for an adult client. The remaining options do not provide time frames that are safe or acceptable. 90. The nurse is checking the insertion site of the peripheral intravenous, 4, catheter. The nurse notes the site to be reddened, warm, painful, and slightly edematous in the area of the vein proximal to the 4 catheter. The nurse interprets that this is likely the result of which: 1. Phlebitis of the vein. 2. Infiltration of the 4 line. 3. Hypersensitivity to the 4 solution. 4. An allergic reaction to the 4 catheter material. Answer. 1. Rationale: phlebitis at an 4 site results in discomfort at the site and redness, warmth, and swelling proximal to the 4 catheter. The 4 catheter should be removed, and a new 4 line should be inserted at a different site. The remaining options are incorrect. The signs and symptoms in the question are not associated with these conditions. 91. The nurse has been instructed to remove an intravenous, 4, line. The nurse removes the catheter by withdrawing the catheter while applying pressure to the site with which item? 1. Band-aid. 2. Alcohol swab. 3. Betadine swab. 4. Sterile 2 times 2 gauze. Answer. 4. Rationale: a dry, sterile dressing such as sterile 2 times 2 gauze is used to apply pressure to the site while the catheter is discontinued and removed. This material is absorbent, sterile, and non-irritating to the site. A band-aid may be used to cover the site after hemostasis has occurred. An alcohol swab or betadine would irritate the open puncture site and would not stop the blood flow. 92. The nurse is preparing an intravenous 4 solution and tubing for a client who requires 4 fluids. While preparing to prime the tubing drops and hits the top of the medication cart. The nurse should plan to take which action? 1. Change the 4 tubing. 2. Wipe the tubing with betadine. 3. Scrub the tubing with an alcohol swab. 4. Scrub the tubing before attaching it to the 4 bag. Answer. 1. Rationale: the nurse should change the 4 tubing. The tubing has become contaminated, and, if used, it could result in a systemic infection in the client. Wiping or scrubbing the tubing is insufficient to prevent systemic infection. 93. A client is going to be transfused with a unit of packed red blood cells, PRBCs. The nurse understands that it is necessary to remain with the client for what time period after the transfusion is started? 1. 5 minutes. 2. 15 minutes. 3. 30 minutes. 4. 45 minutes. Answer. 2. Rationale: the nurse must remain with the client for the first 15 minutes of a transfusion, which is the most likely time that a transfusion reaction will occur. This enables the nurse to detect a reaction and intervene quickly. The nurse engages in safe nursing practice by obtaining coverage for the other clients during this time. 5 minutes is too short of a time period, while 30 and 45 minutes are lengthy time periods. 94. The nurse is assisting with caring for a client who is receiving a unit of packed red blood cells, PRBCs. The nurse should tell the client that it is most important to report which signs immediately. 1. Sore throat or earache. 2. Chills, itching, or rash. 3. Unusual sleepiness or fatigue. 4. Mild discomfort at the catheter site. Answer. 2. Rationale: the client is told to report chills, itching, or rash immediately, because these could be signs of a possible transfusion reaction. Mild discomfort at the catheter site may be indicative of a problem, or it could result from the size of the 4 catheter required to infuse the blood product. Sore throat, earache, sleepiness, and fatigue are unrelated to a transfusion reaction. 95. The nurse is assisting with caring for a client who has received a transfusion of platelets. The nurse determines that the client is benefiting most from this therapy if the client exhibits which finding? 1. An increased hematocrit level. 2. An increased hemoglobin level. 3. A decline of the temperature to normal. 4. A decrease in oozing from puncture sites and gums. Answer. 4. Rationale: platelets are necessary for proper blood clotting. A client with insufficient platelets may exhibit frank bleeding or the oozing of blood from puncture sites, wounds, and mucous membranes. The client's temperature would decline to normal after the infusion of granulocytes if those transfused cells were then instrumental in fighting infection in the body. Increased hemoglobin and hematocrit levels would be seen when the client has received a transfusion of red blood cells. 96. A mother calls a neighborhood nurse and tells the nurse that her 3-year-old child has just ingested liquid furniture polish. Which action should the nurse instruct the mother to take first? 1. Induce vomiting. 2. Call an ambulance. 3. Call the poison control center. 4. Bring the child to the emergency department. Answer. 3. Rationale: if a poisoning occurs, the poison control center should be contacted immediately. Vomiting should not be induced without instructions to do so if the victim is unconscious or the substance ingested is a strong corrosive or petroleum product. Bringing the child to the emergency department or calling an ambulance would not be the initial action because this would delay treatment. The poison control center may advise the mother to bring the child to the emergency department. If this is the case, the mother should call an ambulance. 97. The emergency department nurse receives a telephone call and is informed that a tornado has hit a local residential area and numerous casualties have occurred. The victims will be brought to the emergency department, which should be the initial nursing action. 1. Prepare the triage rooms. 2. Activate the agency emergency response plan. 3. Obtain additional supplies from the central supply department. 4. Obtain additional nursing staff to assist with treating the casualties. Answer. 2. Rationale: during a widespread disaster, many people will be brought to the emergency department for treatment. Although options 1, 3, and 4 may be components of preparing for the casualties, the initial nursing action should be to activate the emergency response plan. 98. The nurse is caring for a client with a healthcare-associated infection caused by methicillin-resistant Staphylococcus aureus who is on contact precautions. The nurse prepares to provide colostomy care to the client. Which protective items will be required to perform this procedure? 1. Gloves and a gown. 2. Gloves and goggles. 3. Gloves, a gown, and goggles. 4. Gloves, a gown, and shoe protectors. Answer. 3. Rationale: goggles are worn to protect the mucous membranes of the eye during interventions that may produce splashes of blood, body fluids, secretions, and excretions. In addition, contact precautions require the use of gloves, and a gown should be worn if direct client contact is anticipated. Shoe protectors are not necessary. 99. The nurse should institute which type of precaution for a client diagnosed with Clostridium difficile? 1. Droplet. 2. Contact. 3. Airborne. 4. Neutropenic. Answer. 2. Rationale: contact precautions are necessary for colonization or infection with a multi-drug-resistant organism. This includes enteric infection with Clostridium difficile. Droplet or airborne precautions are not necessary because the organism is not transferred via the respiratory route. Neutropenic precautions are used when the client needs protection from contracting an infection from others. 100. The nurse enters a client's room and finds that the wastebasket is on fire. The nurse immediately assists the client out of the room. Which is the next nursing action? 1. Call for help. 2. Extinguish the fire. 3. Activate the fire alarm. 4. Confine the fire by closing the room door. Answer. 3. Rationale: the order of priority in the event of a fire is to rescue the clients who are in immediate danger. The next step is to activate the fire alarm. The fire is then confined by closing all doors. Finally, the fire is extinguished.